Hey guys, I'm Dr. Jaclyn. I'm a general dentist with Dental Design Singapore. And today we have another before and beyond case that I'm super excited to share with you. If you've seen my previous before and beyond episodes, I have talked about the kind of cases that I like to do and the kind of cases that tend to find me, I guess, and also what the role of the dentist is in terms of we're not just like there to drill and fill your teeth, although we can do that. It goes beyond just the basics. So today we have a very interesting case, which again combines my two great loves in dentistry. One is smile design and the other is orthodontics as well. So I've kind of given away the game there a bit, but I hope you guys will find this case interesting. So we have this patient here who's not happy with his smile. And you can see, anyone, even a layperson can tell that there's something not quite right. We have a lot of discolored areas on the upper front teeth. And on closer inspection, you can see it's actually because these are some old fillings which are discolored, and there's some new decay, which are the white and the black spots around the teeth. We also have some issues in terms of the size of the teeth. So like this lateral is a bit small, that canine is a bit small as well. And we can see that, the gum levels are not quite symmetrical. And the edges of the teeth are not symmetrical as well. This central incisor is quite a bit shorter than this one. And we can see a little bit of crowding or unevenness and overlapping in the lower. So what's really interesting about this case is most patients, they would actually be quite happy with the lower incisors, but this patient was really bothered by the discoloration on the upper. These are some other pictures from like different views. So you can see the alignment on the upper is not bad. Lower is a little bit more crowded, and you can see that we have a broken tooth up here as well, which was causing problems with eating. So in order to address the concerns, the main concern was the discoloration, and also the patient just felt his smile wasn't even, the shapes of the teeth were not ideal, and he did not like this lower crowding in the front. We decided to actually do a full smile makeover, but because he has active decay and that the broken tooth up here, which is we could not be saved because the decay was really extensive, we actually planned to do basically almost for all his teeth, because they have a lot of large fillings in them, a combination of crowns and veneers, but we would have to realign the teeth before we began. But in a situation like this where there is some old fillings here, we can align the teeth after even during this phase, but I feel that doesn't really, it's not a healthy situation to be in, because there's active decay, and also just changing the fillings here will actually improve things a lot. So the patient will actually get a boost in self-esteem once you resolve this severe discoloration because of the mix of old fillings and decay. So I find that's quite a useful starting point for a lot of patients. They already feel so much better when we remove all the decay, the discoloration, and we just refill everything. So this is how we actually did it. So you can see how extensively the decay is actually involving. It's almost like the entire tooth, the whole tooth looks almost like it's chewed up. So but at least now when we do this, we can take the patient back to much more evenly colored teeth, and he will be in a good position to begin the alignment and tweaking of some of the crowding that he has. So I found this case really interesting because this patient as well was quite anxious. So as you can see, he's had quite a lot of dentistry done in the past, but maybe in a way that kind of traumatized him. So that was a challenge in terms of patient management. But yeah, I mean, treatment like this is quite complex, and it involves multiple visits, because basically we had to work on almost every single area of the back teeth in his mouth, because there was a lot of old fillings that needed to be changed. So I find cases like this quite fun to do, honestly, because you can see that you're making a material difference to the patient. And because you are seeing the patient so often, this case is almost like 2 years like on the go. It just took 1 year for us to like sort out all the decay and stabilize everything, and now he's into the alignment phase. Like, you kind of get to know the patient like pretty well. So I really like that kind of relationship, like a long-standing professional relationship, and both of you are like motivated to reach like the end goal together. So this case is nowhere near finished. We are finishing, like I would say, the second phase of treatment, which is the alignment, and then we'll take a little break before we actually move on to the so-called like the sexy part, where you actually get like some veneers in, and that will drastically improve the brightness and the color of the teeth. So who knows, maybe next year I might be back with another episode featuring the third phase of treatment. But yeah, for now, like, we are just like continuing on with the second phase, which is the alignment. So if cases like this like interest you, maybe just comment down below what you found most interesting about this case, or if you made it to the end of the video, you should comment a heart emoji. Then we know that you watched all the way to the end of this video. If not, like, share, and subscribe, and I will see you guys on another episode of Before and Beyond. Bye!